Hello everyone. Today I'm going to share something that could completely transform how you deal with joint pain. But before we dive in, I'd love to know where you're watching from. Drop your location in the comments below. And if you find this information helpful, please hit that like button and subscribe to the channel for more health tips that can change your life. Now let's talk about joint pain. Did you know that over 54 million Americans suffer from some form of joint discomfort? That's nearly 1 in 4 adults. Whether it's your knees creaking when you climb stairs, your fingers aching when the weather changes, or your shoulders tensing up after a long day at the computer, joint pain can severely impact your quality of life. Many people reach for pain medications as their first line of defense. But these only mask the symptoms temporarily and come with potential side effects, especially with long-term use. What if I told you there's a simple 1-minute technique that could provide immediate relief without any pills or complicated equipment? This method addresses one of the root causes of joint pain that most doctors never mention. It's based on fundamental physiological principles that I've seen work for thousands of patients in my practice. The beauty of this technique is its simplicity. Anyone can do it, anywhere, anytime. In the next few minutes, I'll explain exactly why this works, demonstrate how to perform this 1-minute trick correctly, and show you how to integrate it into your daily routine for maximum benefit. Stay with me because this information could be the game changer you've been looking for in your journey toward pain-free movement. Before I reveal the 1-minute trick, it's crucial to understand what's actually happening in your body when you experience joint pain. Conventional medicine often focuses solely on inflammation, but there's a deeper mechanism at play that rarely gets discussed. Your joints are surrounded by fascia, connective tissue that forms a continuous web throughout your entire body. This fascia can become tight and restricted due to several factors: chronic dehydration, mineral deficiencies, especially magnesium, prolonged sitting, repetitive movements, and stress. When fascia becomes restricted, it creates tension that pulls on joint structures, triggering pain receptors and reducing proper blood flow to the area. Another key factor is something called reciprocal inhibition. This means when certain muscles are chronically tight, their opposing muscle groups become weakened and inhibited. For example, tight hip flexors from sitting all day can inhibit your glutes, creating imbalances that stress your knee and lower back joints. What's more, your nervous system plays a tremendous role in joint pain. When you experience discomfort for extended periods, your brain actually becomes more sensitive to pain signals, a phenomenon called central sensitization. This explains why chronic joint pain can seem to spread or intensify over time. The final piece of this puzzle is lymphatic congestion. Your lymphatic system helps remove waste products from tissues, but it depends on muscle movement to flow properly. Without adequate movement, waste products accumulate around joints, contributing to inflammation and discomfort. Understanding these interconnected systems helps explain why conventional treatments often provide only temporary relief. Pain medications might block the pain signal, but they don't address these underlying mechanisms. The 1-minute technique I'm about to share works because it simultaneously impacts multiple root causes, releasing fascial restrictions, rebalancing muscle activation patterns, resetting pain signaling, and stimulating lymphatic drainage. Now for the moment you've been waiting for, the 1-minute joint relief technique. This method combines principles from acupressure, myofascial release, and neuromuscular re-education into one simple procedure you can perform anywhere. The technique is called reciprocal tension release, or RTR. Here's how to perform it. First, identify the painful joint. Let's use a knee as an example. Sit in a comfortable position where you can easily reach the affected area. Step 1, 15 seconds. Place your thumbs on the exact point of maximum tenderness around the joint. Apply firm pressure. Enough to feel discomfort, but not severe pain. About 7 out of 10 on your personal pain scale. While maintaining this pressure, take 3 deep breaths, inhaling through your nose for 4 counts and exhaling through your mouth for 6 counts. Step 2, 15 seconds. Without releasing pressure, perform small circular movements with your thumbs, gradually increasing the circle size. This releases fascial adhesions around the pain receptors. Step 3, 15 seconds. Now, actively contract the muscles surrounding the painful joint at about 20% of your maximum strength while still maintaining thumb pressure. Hold for 5 seconds, then completely relax those muscles for 5 seconds. Repeat this contract-relax cycle 3 times. Step 4, 15 seconds. Finally, release the pressure and gently tap or pat the area for 15 seconds. This stimulates mechanoreceptors that help override pain signals while promoting local blood flow and lymphatic drainage. That's it. The entire sequence takes just 1 minute. What makes this technique so effective is that it addresses multiple physiological systems simultaneously. It breaks up fascial restrictions, resets hypersensitive pain receptors, activates proper muscle recruitment patterns, and stimulates circulatory and lymphatic flow. Many of my patients report immediate reduction in pain, sometimes by as much as 50–70% after just 1 application. For optimal results, you can repeat this sequence 3 to 5 times throughout the day. Let's dive into the fascinating science behind why this 1-minute technique works so effectively. When you apply precise pressure to a painful area, you're actually triggering several physiological responses that work together to alleviate pain. First, there's the gate control theory of pain. Your nervous system can only process a limited amount of sensory information at once. The pressure and circular movements create competing sensory inputs that effectively close the gate on pain transmission to your brain. This explains the immediate relief many people experience. Second, you're stimulating specialized nerve endings called mechanoreceptors. These receptors, when activated, send signals that override the pain messages coming from nociceptors, pain receptors. This is similar to what happens when you instinctively rub an area after bumping it. The circular friction movements break up something called ground substance, the gel-like component of fascia that can become thick and sticky when dehydrated or immobile. When this ground substance becomes more fluid, tension on pain-sensitive structures is reduced. Furthermore, the contract-relax component utilizes a neurological principle called autogenic inhibition. When you contract a muscle and then release it, the nervous system automatically allows that muscle to relax more deeply than before. This helps reset muscle tone around the joint. The tapping portion at the end stimulates lymphatic flow. Unlike your cardiovascular system, your lymphatic system doesn't have a central pump. It relies on muscle movement and external pressure. The tapping creates a pumping action that helps clear inflammatory compounds from the area. There's also a fascinating hormonal component. This technique stimulates the release of your body's natural painkillers, endorphins and enkephalins, which can provide relief comparable to certain medications, but without side effects. Clinical studies on similar techniques have shown measurable increases in range of motion, decreased inflammatory markers, and reduced pain scores. One study showed a 40% reduction in pain medication use among participants who used pressure release techniques regularly. Now that you understand the basic technique, let's adapt it for specific joints that commonly cause problems. Each joint has slightly different anatomy and optimal pressure points. For knee pain, the most effective points are typically found in the soft tissue depressions on either side of the kneecap, especially the inner side where many people experience tenderness. If you have pain behind the knee, focus on the diamond-shaped area at the center of your popliteal fossa, knee pit. For shoulder pain, The prime spot is usually found in the soft tissue about 2 finger widths below the bony point of your shoulder, a chromion process. For rotator cuff issues, focus on the front and back aspects of the shoulder where the muscles attach. For wrist pain and carpal tunnel, apply the technique to the center of your inner wrist and the forearm muscles about 2 inches up from your wrist crease. These forearm muscles often refer pain to the wrist when they're tight. For ankle pain, target the depressions just in front of your ankle bones on either side and the base of your calf muscle where it meets the Achilles tendon. For hip pain, the most effective points are typically found at the front crease of the hip, the outer hip, about 2 to 3 inches below the hip bone, and the upper outer quadrant of your buttock. For lower back pain, while it's difficult to reach your own back, you can use a tennis ball against a wall or floor. Position it on the muscular areas on either side of your spine, never directly on the spine, and follow the same principles of pressure, small movements, and contract-relax. For neck pain, the base of the skull, especially the slight depressions on either side of the neck muscles' attachment points, responds very well to this technique. Always use gentle pressure here. For hand and finger joint pain, use the tip of your opposite thumb to apply pressure to the sides of the painful joints rather than directly on top of them. Remember, the key is finding the specific tender spots unique to your body. These are often not exactly where you feel the pain, but maybe in the surrounding tissues that refer pain to the joint. Spend a moment exploring the area to find the most responsive points before applying the full technique. While this 1-minute technique can provide remarkable immediate relief, let's talk about how to integrate it into a comprehensive strategy for long-term joint health. This is where many people miss the mark. They find something that works temporarily, but fail to create lasting change. First, consistency is key. I recommend performing this technique 3 to 5 times daily initially, especially before activities that typically trigger pain. After about 2 weeks, most people can reduce to a maintenance schedule of 1 to 2 times daily, particularly in the morning and evening. Hydration plays a crucial role in joint health that cannot be overstated. Your fascia is largely composed of water, and even mild dehydration can increase fascial tension. Aim for half your body weight in ounces of water daily, adding a pinch of high-quality salt to improve cellular absorption. Strategic supplementation can enhance your results dramatically. Magnesium is particularly important as it helps relax tight muscles and is involved in over 600 enzymatic reactions in your body. Most people are deficient. I recommend magnesium glycinate, 300-400 milliliters daily. Vitamin D3 with K2 and collagen peptides are also valuable additions for joint health. Movement patterns matter tremendously. Incorporate daily mobility work, focusing on multi-directional joint movements rather than just forward and back motions. Even 5 minutes of mobility work upon waking can make a significant difference. Anti-inflammatory nutrition is your foundation. Focus on eliminating the major inflammatory triggers, refined sugars, industrial seed oils, and processed grains. Instead, emphasize omega-3 rich foods, colorful vegetables, and adequate protein for tissue repair. Sleep quality directly impacts pain perception and healing. During deep sleep stages, your body produces growth hormone essential for tissue repair. Create optimal sleep conditions: cool, dark room, consistent schedule, and electronics free for 60 minutes before bed. Finally, track your progress objectively. Rate your pain on a scale of 0 to 10 before and after using the technique, noting any patterns or improvements over time. This data helps maintain motivation and allows you to adjust your approach as needed. Implement these strategies alongside the 1-minute technique, and you're not just masking symptoms, you're creating fundamental changes in your body's structure and function. Many of my patients who committed to this approach have experienced complete resolution of joint pain they'd suffered with for decades. Remember, your body has an extraordinary capacity for healing when given the right tools and environment. Take control of your joint health starting today with this simple yet powerful technique.